Hi, Dr. Baird. I'm with a patient postoperatively that I wanted to demonstrate because it was a deceptively a little bit more of a challenging case in her particular case because on the side view, you see the prominent bump that she had. She's noted to have a low radix and the low supratip with a midline prominent bump. These aren't necessarily very common because of the presentation of the bump, given the low supratip and the low radix. So it's important in these cases to provide for like a nice gentle transition between the radix or the high point of the nose and the tip so that it looks natural, but yet you get a gentle slope. From the front, and the reason this case was a bit more challenging is because of the indentation and the asymmetry, particularly in the bridge in her case and what was made up of the bump. So in her case, she had a depressed, what's called right middle vault, or the middle third of the nose, and it was depressed at both the level of the bone, which is the upper third, and the middle third of the nose. So maneuvers were done in her case to try to straighten the nose as much as possible, while at the same time reduce the appearance of the bump like I mentioned before. So she's with us today post-operatively, and as you could see, we were able to get a nice narrowing and refinement to the bridge and a nice straightening effect of the bridge. And I did this by what's called an auto spreader graft, where I used her natural cartilage and inverted them to provide for a straightening here, plus use some soft tissue to buffer this to give a nice result to the middle third of the nose. And then on the side view, we were able to reduce the hump and yet provide for a nice gentle slope so that it appears very natural in shape. Thank you.